Good morning, friends. Today, we're going to discuss regarding clinical use of blood and blood products. It is important to use blood and blood products appropriately and to be aware of the principles designed to assist the health workers in deciding when and when not to transfuse. The appropriate use of blood product is defined as transfusion of safe blood products to treat a condition leading to significant morbidity or mortality that cannot be prevented or managed effectively by other means. These are the few conditions that may require blood transfusion: hemorrhage leading to shock, loss of large volume of blood during operation, severe anemia accompanied by cardiac failure. Use blood correctly. Blood transfusion can save lives and improve health. As with any therapeutic intervention, it may, however, result in acute or delayed complications, and it carries the risk of transmission of infectious agent. It is also expensive and uses scarce resources. Transfusion is often necessary because the condition may eventually require transfusion and can often be prevented by early treatment or prevention program. Transmission of whole blood, red cells, or plasma are often be given to prepare the patient quickly for planned surgery or to allow early discharge from the hospital. Other treatments, such as infusion of IV fluids, are often cheaper, safer, and equally effective. Unnecessary transfusion can expose the patient for unnecessary risk, cause a shortage of blood product for patient in real need. Again, blood is expensive and scarce resources. Risk of transfusion. Before prescribed blood or blood product for the patient, it is essential to consider the risk of transfusing agent and risk of not transfusing. Whole blood or red cells transfusion. The transfusion of red cell product carries a risk of incompatible transfusion and serious hemolytic transfusion reaction. Blood product can transmit infectious agent, including HIV, hepatitis B, hepatitis C, syphilis, and malaria, and so on. Any blood product can become bacterially contaminated and very dangerous if it is manufactured or stored incorrectly. Plasma transfusion can transmit most infection present in the whole blood. Plasma can also cause transfusion reaction. There are very few clear indications for plasma transfusion. Example, coagulopathy, and the risk often outweigh any possible benefits. Blood safety. The risk associated with transfusion can be reduced by effective blood donor screening, deferral, and inclusion. Quality assurance program. High quality blood grouping, compatibility testing, component separation, storage, and transportation of blood product. Appropriate clinical use of blood and blood product. The fundamental principles of the appropriate use of blood and blood product is that transfusion is the only one element of the patient's management. When there is sudden rapid loss of blood due to hemorrhage, surgery, or complications, The most urgent need is usually a rapid replacement of fluid lost from circulation. Transfusion of red cells may also be vital to restore the oxygen carrying capacity of the blood. Minimize wastage of patient's blood to reduce the need of transfusion. Using replacement fluid for resuscitation. Minimize the blood taken for laboratory use. During the best anesthetic and surgery techniques to minimize the loss during surgery. Salvaging and reinfusing surgical blood lost during procedure or the O2 transfusion. Principles to remember. Transfusion is the only one element of managing the patient. Decision about prescribing transfusion should be based on national guidelines on the clinical use of blood, taking the patient's needs into account. Blood loss should be minimized to reduce the patient's need for transfusion. The patient with acute blood loss should receive effective resuscitation, IV replacement fluid, oxygen, and others, while the need for transfusion is being assessed. The patient hemoglobin value, although important, should be the sole deciding factor in starting the transfusion. The decision to transfuse should be supported by the need to relieve clinical signs and symptoms to prevent significant morbidity and mortality. The clinician should be aware of the risk of transfusion, transmissible infection in blood products that are available. Transfusion should be prescribed only when the benefits of the patients are likely to outweigh the risk. A trained person should monitor transfused patient and respond immediately if any adverse effect occur. The clinician should record the reason for transfusion and investigate any adverse effect. Prescribing blood. Prescribing decision should be based on national guidelines on the clinical use of blood taken for patients' needs into account. Before prescribing blood or blood product for patient, keep in mind the following. Expected improvement in the patient's clinical condition. Methods to minimize blood loss to reduce the patient's needs for transfusion. Alternative treatment that may be given including IV replacement fluid or oxygen before making any decision to transfuse. Specific clinical or laboratory indications for transfusion. Risk of transmitting HIV, hepatitis, syphilis, or other infectious agent through the blood product are available. Benefits of transfusion versus risk for the particular patient. Other treatment options of blood is not available in time. Need for trained person to monitor the patients and immediately responds if a transfusion reaction occurs. Monitoring the transfused patient. For each unit of blood transfused, monitor the patients of the following stage. Before starting the transfusion, at the onset of the transfusion, 15 minutes after starting the transfusion, at least every hour during the transfusion, at 4-hour intervals after completing the transfusion. Closely monitor the patient during the first 15 minutes of transfusion and regularly thereafter to detect the early symptoms and signs of adverse effect. At each of these stages, record the following information of the patient's chart. The general appearance, the temperature, pulse, blood pressure, respiration, and fluid balance, including the oral or the IV fluid intake and the urinary output. In additional record, the time of transfusion is started, the time of transfusion is completed, the volume and type of all product transfused, the unique donation number of all product transfused, any adverse effect. Responding to a transfusion reaction. Transfusion reaction may range from a minor skin rash to anaphylactic shock. Stop transfusion and keep the IV line open with IV fluids, normal saline or ringer lactate. But inform the doctor. While making initial assessment of the acute transfusion reaction and seeking advice. If the reaction is minor, give medication as per doctor's order. Managing anaphylactic shock from the mismatched blood transfusion. Manage the patient as for shock. Inform the doctor. Follow the doctor's order. If the patient with bronchospasm occurs, inform the doctor and follow the doctor's order. Combined resuscitation measured above until stabilization. Monitor renal, pulmonary, and cardiovascular function. Documenting a transfusion reaction. Immediately after the reaction occurs, take the following samples and send with a request form in the blood bank for laboratory investigation. Follow the hospital protocols. Thank you for watching. I hope you learned from this topic. This is a brief information, but if you have any idea, you are free to comment down below. Thank you and God bless.